From wearables that measure our heart rates and activities to medical devices that remotely connect patients with doctors, wireless technology is putting patients first and helping improve outcomes. Before mobile technologies, people in rural or isolated areas had limited options, often traveling hundreds of miles to see a specialist, receive treatments, or manage a condition or chronic disease. Thanks to the quality, patient-first healthcare powered by wireless, doctors can seamlessly connect with their patients from rural areas to major cities and everywhere in between, monitoring and managing risk factors before they become larger problems. For example, Columbia University recently announced a breakthrough that put more than $18,000 into a $34 smartphone attachment that can test for diseases such as HIV. Remote monitoring allows many patients to live their lives at home. It helps save patients and their families countless hours of travel to and from medical visits and puts everyone at ease that their loved one's health is under control. In a U.S. study, elderly and chronically ill patients were remotely connected to their doctors while staying in their own homes. In the first 8 months, ER visits were reduced by 38%, while each participant saw their own out-of-pocket healthcare savings of up to $700 a month. For patients and their families, it's a win-win, since it's less time in the emergency room. It also means that doctors are able to manage their patients' health before problems arise, so that it's less intrusive. During the Ebola crisis in West Africa, misinformation and a lack of training in the field were huge barriers to containing and treating the disease effectively. UNICEF and IntraHealth's eHero program helped link thousands of Liberia's healthcare workers in the field with UNICEF's health authorities, allowing them to share real-time information and contain the disease. These mobile devices and services require a wireless connection to transmit health data to and from the patient to the connected medical team. Today, more than 1 in 3 people use mobile health, but by 2018, it's projected that 74% of remote patient monitoring connections will be via wireless networks. Relaying health information in real time is vital, so it's important these wireless network connections are reliable anytime, anywhere. Mobile health, to reach its full promise, needs faster and more reliable networks with less latency and increased capacity. To achieve that, wireless companies need more spectrum. mHealth is just one important piece of the spectrum puzzle. Led by wirelessly connected devices, wearables, and the apps and wireless services consumers love, data traffic is expected to increase 7 times existing levels, reaching 3.6 exabytes a month in 2019. Wireless companies are investing billions to meet Americans' demand for their mobile connected lives by acquiring spectrum, including the upcoming 600 MHz broadcast incentive auction. Learn more by visiting ctia.org/spectrum.